For nursing students preparing for skills check-off.
Any skill, once again, that I am doing, I am educating the client on what it is that I'm doing and why I am doing it. Knock, knock. Hello, Mr. Doe. How are you? I'm Judith. I'll be your nurse for today. Is everything fine? Are you in any pain? Do you have any allergies that I should be aware of? Perfect. Okay. Can you verify your name and date of birth for me? Perfect. All right. I'm going to go ahead and insert a Foley catheter because it was ordered by your doctor. We notice that you continue to retain fluid. So to help alleviate that fluid retention, we're going to go ahead and temporarily insert a Foley catheter. Is that okay with you? Perfect. All right. So prior to me inserting a Foley catheter, I'm just going to go ahead and provide perineal care.
Be sure to perform hand hygiene prior to the start of care.
So we're going to provide perineal care just like I demonstrated to you prior to you even
After
touching the
perineal
kit.
care,
Now,
perform hand
when you
hygiene
have
before
your
using the
Foley
kit.
You are going to inspect the kit first, making sure that all the contents that are within this kit are what you need. All right. You are also going to make sure that the kit itself is intact, that is not disrupted or disturbed in any way, shape, or form. If it's punctured, you are not using it. Simply dispose of it. Better safe than sorry. You're also going to look at the size, usually mentioned here, 14 French. You need to know that because you need that for documentation. Because if you insert the kit, number one, and then let's say, for example, it's not staying in place or there's something else going on, the doctor will need to know this so that they can make adjustments as necessary. Also, you're going to note the expiration date, which is usually on the side right here. The other thing you want to make sure you note is like how much fluid you're going to inflate the balloon. Let me say this, you're going to hear different things. If the kit says to inflate the balloon with 5 cc's, you are inflating the balloon with no more than 5 cc's. Let me say this again. The kit says to inflate the catheter with 5 cc's or 10 cc's. Whatever is on the package is what you administer. No more than that. Okay? If you find that you're going to need more than that, you need to notify the physician and they need to take care of it on their end. Because if you inflate it more, you can damage the integrity of the catheter, one, and also you can cause harm to the patient as well. I'm going to open the kit. I've expected it. If you feel that you would be more comfortable having 2 tables for setup, then have 2 tables for setup. Also, just bear in mind, you're going to have to work within the limitations of the space that you got. Okay, you may not always have a lot of space. I can choose to use this as my trash bin, or I can use this actual trash bin. I'll dispose of this, keep this to the side. When you are preparing any sterile field, make sure it's clutter-free. Nothing on your space. Keep it clear. You see how this little latch is facing away from me? Wait, turn it towards me. You are opening the kit with your clean hand. If you want to use gloves, that is perfectly fine, but you're not required to use gloves, okay? As you open, I pull this little latch.
Be sure to open the kit in this specific order.
Open away. You see I form like a little C? I'm not going to go over and open. If I open like this, I have broken sterility. So when you're opening, because I don't want any problems, you're opening like a little C, okay? And you open. And try not to bend like so. Keep it just straight. We cool? All right? And these do flat back. Bring this to the middle and open towards the side. And remember, just like any other sterile field, you have the 1-inch border that you're allowed to touch with your
Remember the order to open.
So away, to the side, and then towards me last. So I'm gonna kind of tot it a little bit. And then now it's straight down. Okay. You see, the only thing I can touch with my bare hands is this gloves. That's it. Everything else I cannot touch with my non-sterile or bare hands. Does that make sense? Put this to the side, and now I'm going to don on sterile gloves. All right? I'm going to turn this because I'm a little bit clumsy. Turn this away, and then I'm going to now apply sterile gloves.
I realized I failed to uncover the perineal area prior to donning sterile gloves.
Legs up for me like a frog or straight up? Okay, perfect. All right. Hand hygiene. Now I'm going to go ahead. I can only touch now with my sterile hand the middle area. I'm going to just bring this to a position that is comfortable for me. I'm going to show you two methods in which you can transport these sterile equipment to the patient's bed.
Be sure to step away from the sterile field as you unfold the drape.
So you have this, shiny side is always down. You can use this little tackle method.
Ensure your sterile gloved hands does not touch the client or any unsterile surface
Now,
area.
this is a fenestrated drape. It is optional. It's not required. Not everybody uses a fenestrated drape. And a fenestrated drape simply means that it is a drape that just has a hole in it. It doesn't matter what side you put down. You simply lay that like so. You see how I laid it down?
Exposed insertion site maintains sterility.
Put that like that. Okay, it just gives you more protection in terms of sterility. Method one. I'm going to put this to the side. If I'm going to go with both trays, I just like to get rid of the plastic first. Now I wrap the catheter around my hand as I remove the plastic to have a better control so that this catheter is not flopping all over the place. Drop. And I place this back inside.
Open lubricant wide enough for use.
I can pour the lube here. And then I can also open this and then put my swabs in here. I'm going to connect, only connect my syringe to this valve and then leave it. Do not pre-inflate. You're gonna see a lot of us old school nurses doing that. Your books say don't do it, don't do it. And the reason you're not supposed to do it is because you risk damaging the integrity of the tip of the Foley catheter. Okay, but for checkoff purposes, do not pre-inflate. If I'm going to go with both trays, I have my lube, and then I have my swabs. I am going to safely transport my tray. This is sterile to sterile. I'm going to put this small tray with this equipment here at the back end, and then I'm going to put this tray here like so. If you notice, I put the tray where the catheter is towards the perineal area. Because if I have it the other way, as I get ready to insert the catheter, I'm going to be playing tug of war, and it makes it worse for me, fighting to maintain sterility. Method two, in terms of transporting the equipment. one thing I like
Optional,
to do is go
insert
ahead
catheter
and
tip into lubricant packet.
simply insert. You'll also see what nurses will do is just go ahead and pour the lube in here. That's perfectly fine. It's still sterile filled. Okay? I just like to leave it like so. It's right here. Because there's iodine on my gloves, if I want to, I can go ahead and don on new sterile glove. But because this is still sterile technique, I didn't touch any non-sterile part, I do not have to don on new sterile glove. And then I'm only transporting now just one tray. Again, I am choosing to make sure that bifurcation is towards the perineal. Now, this is simply going to be now my clean hand. All right? As soon as I touch the labia, it's a clean hand. I'm going to take now one swab and go down. You see how I just threw that in there? If I make it, I make it. If I don't make it, I do not make it. I do not want to see you reaching in. You have broken sterility. If you feel like it's going to be an issue, just have your trash bin next to you. You could do that too. Now I'm going to do
swab opposite side.
now the middle
top
side.
to bottom.
Top to bottom. Dispose. And I dispose of this to get that out of my way. Mrs. Jones, I'm going to go ahead and insert the Foley catheter. Can you take a deep breath for me? Now I'm inserting. Clients with a vagina, I insert until I see a flash of urine. Once I see a flash of urine coming out into the tube, I will just simply advance about 2 inches more. And then you can hold this clean hand because the part that is sterile is already inside the patient. And now I'm going to inflate with 5 cc's.
As per the manufacturer.
And then remove. And now I'm going to tug back. It's in place. Now my sterile part is done. I am simply going to now attach this to the thigh. Bring this over. And now attach this part to the non-movable part of the bed, which is right here. Or I can put it right here. For clients with a penis, the same method still applies. The only difference with the penis is that I'm going to ensure I've held the penis in a 90-degree angle, and then I go in with the catheter all the way in. The penis, you have to go all the way to the bifurcation, or the other name is the Y. Attachment, again for penis, upper thigh, lower abdomen, vagina, inner thigh, in terms of attaching. And that is it, okay? Now, let's say you have an order to collect urine sample. You will hear different things, okay? In terms of, oh, if it's a new Foley catheter, I can get it from the back. No! I don't want to hear that. You will always collect your urine sample at the port.
Clamp tubing using attached clamp or
Manually clamp it. You have to clamp it and collect urine, and once you see urine begins to collect
within the tubing,
you will now use a hospital-approved solution
to cleanse
and
the
then
port.
a syringe that actually fits the port. You will attach that syringe to fit the port, and then you will draw out the urine. Draw as much as you need, and then simply transfer it into the container. Okay, and if you need to repeat the process, go ahead and repeat it. Close, patient label, put it in a biohazard bag, send it off to lab.